Let us explore more about autosomal dominant PKD. ADPKD has further two types, type 1 and type 2, which depends on which gene gets mutated. Type 1 is caused by mutations in PKD1 gene, which codes for polycystin 1 protein of primary cilia. Where is the hometown of PKD1 gene? Address of PKD1 gene is 16p13.3. Let me elaborate this address. It means gene is present at position 13.3 on P, which is the shorter arm of chromosome number 16. Now it's the time to dive in type 2, which is caused by mutations in PKD2 gene, which codes for polycystin 2 protein of the primary cilia. Address of PKD2 gene is 4q21 to q23, which means the gene is present somewhere between position 21 and position 23 on Q, which is the longer arm of chromosome number 4. Now just grab your attention to learn about the signs and symptoms of ADPKD. The first one is hypertension or high blood pressure. The second one is urinary stasis or accumulation due to compression of collecting tubules by expanding cysts. The third one is back or side pain. The next is hematuria or blood in the urine. Next is feeling of fullness in abdomen. And the last one is increased size of abdomen due to enlarged kidneys. Hypertension develops due to fluid retention caused by the activation of renin-angiotensin-aldosterone system. Why is this happening here? The reason behind this activation is hypoxia or lack of oxygen and poor blood perfusion to healthy nephrons as blood vessels get compressed by enlarged cysts. Signs and symptoms of ADPKD may worsen with time and leads to complications like UTI or urinary tract infections, kidney stones, kidney failure or ESRD, that is end-stage renal disease, heart valve abnormalities, typically including mitral valve, aortic and brain aneurysms, which is abnormal bulging in the blood vessels, which if rupture leads to bleeding, and preeclampsia, which is a pregnancy complication in which the woman have high blood pressure and the signs of organs damage. Now we will discuss about the diagnosis of polycystic kidney disease. We have two categories in this case. First one is imaging tests and the second one is genetic test. Imaging tests are performed to search visuals of cysts in three ways. First one is ultrasound imaging, which involves the use of ultrasound waves. Second is abdominal CT scan. CT stands for computerized tomography, which utilizes X-rays. CT scans are more common and less expensive. CT scan machines are open like a donut, which prevents panic condition of patient in a closed space. The third one is MRI, or magnetic resonance imaging, which uses strong magnetic field and radio waves. MRI scans produce more detailed images. MRI machines are often closed at end, but now open MRI machines are also available. The findings on imaging are bilaterally large kidneys having cysts and oligohydramnios. The second tool is genetic tests, which are performed via a sample of blood to figure out the type of PKD or likelihood of carrying the disease. Both tools are same for all the types of PKD. Now just hang on a little more to learn about the treatment for ADPKD. Well, there is no permanent cure for ADPKD, but there are ways to tackle symptoms. Antihypertensive medicines are prescribed to control the high blood pressure. There are antibiotics which are used to resolve the urinary tract infections. Patient can also go for dialysis, which is mimicry of kidney function. The last resort is kidney transplantation. Dialysis and kidney transplantation comes under the head of renal replacement therapy or RRT, which means they replace the normal functioning of the kidney.